when you're thinking of even conceiving, you have a lot of, work to do. First thing that I recommend the couple, not just the female, is I have them come in to see me and I evaluate their lifestyle. Find out, what they're eating, what their work schedules are, how many hours they sleep a night, if they're exercising, if they're taking nutrients. Based on, everything that they tell me, I like to put them on a detoxification program. A lot of foods that we have available to us today are full of a lot of chemicals, which alter our abilities to function properly, to conceive easily, to develop a healthy fetus.
The issue of prenatal vitamins is a very important issue. It's important you take prenatal vitamins before you become pregnant. And for most patients, it's probably not too critical which one you take, although there are some benefits of certain vitamins. A vitamin that contains the DHA, or the essential fatty acids, those have been shown to help prolong pregnancies for women who may be at risk for preterm delivery, as well as enhance the baby's eyesight and brain function as well. So you may have that benefit if you take a vitamin with one of those DHA or EPA essential fatty acids. Many times women will ask me in their early pregnancy when they're nauseous that they say, do I really have to take my vitamins? I'm very sick. And the answer is no. You won't harm your baby if you skip taking your vitamins for a while. The most important vitamin to take, though, at the beginning would be a B vitamin, and especially one with folic acid. That's vitamin B6. And you should have about 400 micrograms a day, or about 0.4 grams for the average patient. Also, vitamin B6, with or without B12, may also help alleviate nausea as well. So I'll tell my patients who are very nauseous in the first trimester, just take a B vitamin, and I'll give them their folic acid and may help alleviate their nausea as well.
So, you're thinking of having a baby? Well, now's your best time to learn CPR before the baby comes. Now you want to be prepared so that if anything does happen, you're one step ahead. When do we want to start CPR? We want to start CPR in any person who is unresponsive, meaning they're not responsive to any kind of stimulation, any kind of touch, verbal, and we also want to make sure that they're not breathing. If they're not breathing, then we need to start CPR immediately. So what should you do if you're doing CPR and you're by yourself? Who's going to call 911? After you do 2 minutes worth of CPR and you're by yourself, call 911. If somebody else is with you, ask them to go call 911 for you while you continue with CPR. Remember that if you're with an adult, they usually have a cardiac problem, so you want to get 911 immediately. What should you know before you start CPR? Remember the basics, A, B, C. Airway, breathing, and circulation or compressions. And we're going to go ahead and show you that now. How do you distinguish if a baby is completely obstructed, meaning choking? Well, if no noise is being heard and there's no coughing involved, the baby is probably totally obstructed. At that point, we want to continue with our 5 back slaps and our 5 chest thrusts, which we will go on to demonstrate. Remember that if a baby is making any noise whatsoever or coughing, that they're not completely obstructed, and no back slaps and no chest thrusts should be initiated.
So it's important for moms to know the benefits of breastfeeding, and one of the biggest benefits includes rapid weight loss. Because you're burning so many calories when you nurse your baby, it's actually important again to take in a bit more calories than you took during the pregnancy. Consider that you are burning about 500 calories per day when you're breastfeeding. So rapid weight loss is expected, and usually it's appreciated by that new mommy. Other benefits to breastfeeding include decreased chances of osteoporosis because the bone densities actually hardens with each breastfed baby. In addition, babies tend to be healthier. Babies actually have decreased viruses and illnesses, and if they do become sick, they actually recover a lot quicker. So the benefits to breastfeeding, in addition to financial, meaning that you don't have to buy any formula because you're producing that breast milk and you're saving tons of money. Some have even estimated about $12,000 a year just by breastfeeding are saved. So there are benefits financially, physically, and wonderful bonding time for you and your baby. As the mother of 5 children, I'd like to share with you that each breastfeeding experience with each child is different. However, at no point should breastfeeding be uncomfortable or hurt, unless there's a poor latch-on, and that happens to be the #1 reason for moms choosing to quit breastfeeding earlier on. So I'd like to share with you just a bit about latch-on positions for that baby to make sure that you are enjoying each breastfeeding experience. Your baby can open his or her mouth very wide, and that's what you're looking for that baby to actually open up quite large and take in your nipple and most of the area around the nipple called the areola. When the baby suckles on the nipple and areola, breastfeeding is quite comfortable. There are times when your nipples may become sore or cracked or even bleed, and if that happens, if you can tolerate a sore, cracked, bleeding nipple, you can allow your baby to nurse from that side. Some techniques that you can use to heal those sore, cracked nipples include putting a steeped tea bag on the nipple directly. So that means that you would allow just a regular tea bag to steep in hot water for about 1 to 2 minutes, and then place that tea bag directly on the nipple. It's a normal, easy way to allow that nipple to heal. You can also use a cream for breastfeeding that's a lanolin cream that allows the baby to nurse even with the cream on the nipple, but helps to heal those sore, cracked nipples. The good news concerning breastfeeding is the size of a woman's breast does not matter. Babies are happy no matter what the size. There's an incredible myth, actually, that a mommy with breasts that are too small won't produce enough milk. But thank goodness it's just a myth. It's no truth to that whatsoever. So again, if you have any concerns concerning the largeness perhaps of your breast, working with a lactation consultant prior to your baby's birth is advisable.